Good evening, everybody. Welcome to our December Internationally Educated Nursing webinar. This is our December one, so the last one for 2023, but we have 4 more webinars that we'd really like you to join us in 2024. So please have a look out for the information around those. We have had previous sessions and they are available on our RCN website again for you to access, so please take a look at those the previous sessions. As we move through Charlotte's presentation, I'll introduce Charlotte in a moment. As we move through Charlotte's presentation for this evening, there is a Q&A tab at the top of your screen. Please use that to post any questions that you have for Charlotte, and we will ensure we have some time for questions at the end of her presentation. I'm Teresa Budry. I'm Regional Director for the Royal College for Eastern Region and East Midlands Region. And I'm going to hand you over to Charlotte to start her presentation. Charlotte.
Hi, thank you, Teresa. Hi, I'm Charlotte Collings. I'm a recruitment and retention nurse at the Princess Alexandra Hospital, and I'm the RCN Eastern Board Vice Chair, and I'm hosting today on behalf of the East Midlands region. So today is our presentation on understanding the NMC's Test of Competence, and hopefully you'll enjoy it. It's quite a long one though. If I can get the next slide, please. So I'm hoping by the end of this evening session, you'll hopefully have a greater understanding of the NMC's Test of Competence and how it works, and feel a bit more confident in offering support to colleagues that are undertaking this. And you should hopefully gain an insight to how the RCN can support our international colleagues as well throughout this process and beyond, because there's some fantastic resources that we have. If I can get the next slide, please. So what is the Test of Competence? So initially this was introduced in October 2014, so it's quite old now. It's coming up for its 10th anniversary. And it's evolved and changed considerably since it was first implemented those 9 years ago. But it's a 2-part exam to assess the competence of the applicant to join the NMC register, and it's mapped against the future nurse standards. And it does include a maths exam as well. Part 2 is your OSCE, which is a practical exam, which is the main bit that I think people want to focus on this evening. But part 1 is our computer-based test as well, which is a multiple choice questionnaire. I'll go through both of those later on in the slides. In order to complete your Test of Competence, that you need to achieve 100% on all components in order to then get your NMC pin at the end. And that would help you get onto the relevant part of the nursing register that you sought to apply on, so be it that adult nursing, learning disabilities, midwifery, whatever. Next slide, please. So why do we use the Test of Competence? So this is to ensure that we're demonstrating the expected values and skills of the NMC Code of Conduct, and considering the 7 platforms and annexes of the future nursing standards. It's to also ensure that we're encompassing the 4 themes of the NMC's code. And our behaviours should be aligned to the code, and the various testing methods that the Test of Competence offer us enable us to fully see the candidate's abilities. And a lot of the things that we're assessing can only be seen through clinical practice, hence having a practical exam. We also need to demonstrate both understanding and the ability to use our 6 Cs, and demonstrate both responsibility and accountability through the practice that we do. So again, an OSCE is a perfect example of being able to demonstrate those skills. We also need to show that we have our professional behaviours aligned to the code, and we're utilising evidence-based practice that is available to us. So the Test of Competence has been created in order to continually evolve. So as it is undertaken by its candidates, we can continue to understand what's working well, what's not working so well, and how we can assess and reevaluate that. So it's a continually changing process. So as a lot of you may well have seen if you're educators doing this. If I get the next slide, please. So who is the Test of Competence for, and where is the exam? So this is for our international nurses, international midwives and nursing associates. And as of January 2020, it's also been a really good tool for return to practice nurses or midwives to undertake as well, instead of the traditional university courses to re-register on the NMC. So presently the fields of the test of competence are your adult nursing, paediatric nursing, mental health nursing, learning disabilities nursing and midwifery, and we've also got nursing associates there as well. Some candidates will need to sit an additional English proficiency exam, such as your OET or IELTS, or demonstrate English proficiency, which again I'll go through later on in the slides. Presently, there's 5 test centres in the UK and they're listed on the bottom of this slide. There had been discussions quite a while back now about the possibility of creating OSCE test centres abroad. I've not heard anything more of it, and you never know, it could be something that's explored in the future as well. If I get the next slide, please. So English language requirements. So this has changed recently. So back in 2022, the NMC had done a consultation nationwide to understand what people felt of the current process of demonstrating English proficiency, whether or not they liked it, disliked it, and how to improve it. And ultimately, as a result of that, we've had a lot of significant changes as to how we demonstrate proficiency within English, because it is quite a difficult one, particularly the examinations, if that's the route that you need to go down. They're tough exams. So hopefully I can help you make sense of this, but it is quite complex. So my number one tip is, if there's any doubt and you can't be 100% certain, speak to the NMC, is the ultimate baseline of this. So currently the NMC now accepts 3 forms of English proficiency. So that is trained and assessed in an English majority speaking country. Another route in is having 1 year or more of practice as a registered nurse, midwife or nursing associate in an English majority speaking country, with the addition of having an English exam which can be expired, or having 12 months or more experience in an unregistered capacity working in a healthcare setting in the UK. And finally is your traditional routes, which is your English language testing, so your OETs and your IELTS, which are the 2 forms of English testing that are available. I know some people have NARIC certificates, but this is not accepted, and that's because that's really only assessing your written ability for English, not the ability to speak, understand, etc. So NARIC is not an accepted form of proficiency. So if we can go on to the next slide. So trained in English. So if you were trained in English and you were assessed in an English majority speaking country, so an example of that could be Jamaica, you will need to provide the evidence as the candidate applying to the NMC, and the NMC would need to verify that that programme meets the criteria. That's not for your employer to demonstrate, that is up to the individual applying to the register to demonstrate. The NMC have a full list of countries which they recognise as English majority speaking countries, and that list is determined by the NMC, not your employer. So again, if you can't see your country on there, but you feel that you meet that criteria, please call the NMC. If the NMC does not accept your proof as proficiency in English, you would need to explore the other options available to you, and factor this into your plans to register with the NMC, because if you then go down the route of sitting an English exam, that will take time and preparation, and there'll be additional financial implications for that. So that could delay your ability to join the NMC register or apply for the next components to maybe come to the UK if you're not here already. So do factor that in, and again, like I said, ask the NMC if you're not sure. If I can get the next slide, please. So we've got our English language tests. So this, again, it's a more complicated one. So there's 2 types of English language tests that you can sit to demonstrate proficiency that the NMC accept, and that's your OET and your IELTS. The main differences, which is what this slide's going to go through, is that your OET, that is your occupational English test. So that is an occupation focused exam. So as a nurse, you'll have scenarios coming up in that exam which be relevant to your field of practice. So you might find some nursing or healthcare related scenarios which will help your understanding perhaps. Your IELTS, it can be a bit more generic. It's more randomised. You can have a scenario perhaps on aviation, for example. I know somebody said that to me in the past. And that sometimes might just feel a bit overwhelming, and because it's less familiar, it's up to the individual. But I typically find most nurses I teach, they have a preference for the OET over the IELTS, but they're both the same essentially. The other thing you need to consider is the IELTS is approximately half the price than the OET. So prices are approximate, and that's simply because different countries and different providers charge different rates. And until you're at the point of registering the exam that you're choosing in the location and the provider, you're not going to get a fixed price. So you can't just run a Google search beyond having an approximate price. So that's something you need to factor in, because obviously if you fail an OET, that's another £300 or so you're going to have to spend on a resit, whereas if you failed the IELTS, you might only be paying another £160. So there's quite a big financial difference between the two. IELTS is typically more widely available internationally as well. Some countries have difficulties in reaching OET test centres nearby. So for instance, when you look at the countries within Africa, a lot of them are quite far away, because I believe one of the test centres, the closest one, is actually in like South Africa or something. So if you consider just how big Africa is, that's a long distance, and quite a lot of the time it involves flights, accommodation. So that's the additional cost people would need to factor in. So there's a lot of pressure to pass that test first time. So like I said, neither is easier or harder. It's all about personal preference and whatever you feel most comfortable with. So whatever exam you do take, it's valid, providing you pass it, it's valid from 2 years in the eyes of the NMC to be accepted as part of your NMC registration process. And the NMC have now relaxed the rules around combination of test scores. So if you marginally fail an exam, you can combine that test result to then put them together to then pass, which if that is the case, so if you sat your OET on the 1st of June this year and you failed it, but you met the criteria with that exam to then combine it in the future, you would have up until the 31st of May next year to then pass that test with a combination result, whereas historically that used to be 6 months. So that's a positive from this. You've got a bit more time to combine those tests. Again, that's quite a complex thing to understand whether or not you've passed or failed, or if you need to combine or not. So the NMC do have a test calculator on their website that you can use to input your test results, and they'll be able to tell you what you need to do. If you also can't cross the exams, so if you start with IELTS and you're going to combine that, you have to do IELTS. You can't do IELTS and OET. Can I get the next slide, please? So this is just a brief one about what the pass rates are. Again, this is all on the NMC's website, and like I said, there's a really handy combination calculator that the NMC provides to you. So please do have a look at that and familiarise yourself with it, because you might even have nurses that come to you and ask you that if you are one of the employers in this webinar at the moment. Next slide, please. So we've then got our Scythe, which is our supporting information from employers to recognise English proficiency as well. So again, this is quite new for a lot of us as UK registered nurses in supporting our colleagues here already. So again, doubt, speak to NMC, speak to your senior managers and get some advice. But in essence, if you were trained and assessed in an English majority speaking country, you can get your employer or your university to provide evidence of this over, and that will be your supporting evidence. If you have an English exam, which has technically expired, it doesn't matter as much, but you've worked 12 months in an English majority speaking country, so perhaps you trained in India and you've sat an OET or an IELTS and you've travelled over to work in Guyana or Jamaica or Australia, somewhere that's English majority speaking, and you then work there as a registered nurse, registered midwife in a registered capacity for 12 or more months, you can get that employer in that country to verify that you are proficient in English throughout your duration of employment with them. And that should be accepted by the NMC, in theory. Again, we need to verify this with the NMC if there's any doubts. Or if you are already within the UK and you have been employed in a unregistered capacity for 12 months or more, and your manager, your line manager, knows you personally for 6 of those months at least, they can also sign a Scythe form as long as they're band 6 and above or equivalent. And this then needs countersigning by an 8A and above or equivalent pay grade. Both of those people need to be NMC registered. So for me, the biggest question we used to get was, how can I be sure that this person is English proficient? I'm not an English trainer. How do I know? Because this accountability will then fall onto myself if I'm signing this form or if there's a problem. So it's very difficult because a lot of your colleagues might come to you and ask in good faith, and you would like to sign it in good faith. But we need to be sure not to put pressure on our senior colleagues to sign these forms, but we also need to, as that senior colleague, to find out what the due process is within your organisations to safely support this person in obtaining their English proficiency standard via yourselves. Or if you feel, actually, I'm not sure that you are proficient, but we would support you, perhaps you would support them then to obtain an IELTS or an OET exam in the future. So whatever your organisation is doing, you'd need to seek advice. And again, if there's doubts, speak to your senior colleagues, speak to the NMC. Next slide, please. So this is our CBT, our computer-based test. And this is currently at £83, the cost to the candidate. So for me, I'm highlighting the costs of all of these different components of the test of competence, so you can really understand from the candidate's perspective how much they've already invested before they've got their PIN and before they've even paid for their PIN, most likely as well. So it's £83 for a sit of the CBT, and you can have a maximum of 3 attempts. Before, if you was to fail your 3rd attempt, your NMC account will be closed for 6 months and you'd then need to reapply and start the process over again. Typically though, it's got a very high first time pass rate. So approximately between 80 and 90% of candidates will pass the CBT on their first attempt. So it is quite high. And then typically the rest will soon pass on the 2nd or 3rd attempt. So all of the pass rate percentages, that's also on the NMC's website for anyone that's interested to have a look at the passing rates. This is a multiple choice questionnaire, and again, it's a very easily accessible exam in terms of it's an internationally sat exam. You can sit it in most countries, you can sit it in the UK as well. And it's a really robust process. It's filmed whilst the candidate is in there, so you can always go back if there was any doubts at all. You can always go back and watch that candidate sit the exam. So there's 2 parts to it. Part A is approximately 30 minutes long, and this is your numeracy questions. And then part B, it's up to 2.5 hours long. Some candidates tell me they don't need that length of time and they're able to leave sooner if they're happy. And there's 100 clinical multiple choice questions, and that'll be relevant to the part of the register that you're signing on to. So something to bear in mind with these multiple choice questions is that quite a lot of the time you're given a question and you've got 4 answers you can pick from, and a lot of them feel like they could be the right answer. So in that case, it's then identifying what would you do first out of those 4 things. If they are all things you would do in this scenario, which one is the most important to do first? So there's lots of different training resources online and mock exam resources that you're able to obtain for that. So definitely have a look at it. But again, most of the nurses that you see have already completed this stage, and it's normally a prerequisite for interview, along with the English proficiency being signed off as well, for a band 5 or above nursing role. So the test result, once you complete it, typically you find out sooner than 48 hours, but it can take up to 48 hours to show in your NMC online account. Next slide, please. So we're moving on to our OSCE now. So our OSCE is our objective structured clinical exam. This is our practical exam, essentially. This can only be sat in the UK presently, and we've already gone through where you sit that, etc. So this is designed to assess your ability to competently apply your professional nursing or midwifery knowledge and skills against the national policies, standards and guidelines, with examiners there in the room live watching you with a checklist to evaluate how you're performing as a candidate. The level expected at your OSCE exam is that of a nurse or a midwife as they enter the profession at the point of registration. So think of your final year student nurses on their management placement, how they would typically perform in their clinical environments. This is the sort of baseline level we're looking for. You need to be able to show that you're capable of applying your knowledge to the care of service users at the level expected of a newly registered nurse or midwife. So I've already covered that. And you need to demonstrate your best practices and published evidence, so not local arrangements or policies. So just because your trust do something, your NICE guidelines might vary slightly, or, you know, just make sure you're aware of what the national expectations are. It's about testing your abilities as opposed to being able to recite facts. So one thing I'm often saying to candidates is don't be scripted. If you're scripted, the examiners will be able to see you're scripted and they will challenge you. You know, they will adapt things slightly to see, can you respond to change, or does coming off your script affect your ability to perform in this scenario? So this is not an OSCE, an Oscar is an OSCE. So you're not here to demonstrate your ability to act, you're here to be a nurse. So please take it seriously and listen to what's happening. You'll need to pass areas identified as red flags to ensure your safe and effective care. And all candidates will see the same clinical-based problem and be expected to perform to the standard in the given time frame as well. So again, one of the biggest complications I see, mistakes that I see, is people overcomplicating things. So quite often people are very quick to say the patient's dehydrated, we should give them IV fluids. Have we tried a glass of water first? Is typically my response. So again, think of your student nurse levels. I would expect somebody to think of a glass of water over IV fluids in the first instance. And remembering it's about the development of your skills, not reciting scripts. I cannot stress that enough. So again, when you look at your, if you look at the handbooks, it sort of shows you, it looks like a tick sheet. And again, the belief is that you have to start at the top and work all the way down to the bottom. That's not the case. You have to work what feels natural to you and how the scenario flows. So you might jump around that tick list a little bit, but as long as you clear all of the components, that's fine. So I'm just going to go on to pass rates again. So again, this is all on the NMC's website, but in 2022, the pass rate across all of the test centres for overall passes sat at about 74 to 79%. So when you consider that, that could be about 20-ish% of all candidates then failing and having their application closed for 6 months. That's quite a high failure rate to me. That feels high. And if you look at this year's data so far, I was quite surprised myself in seeing this, but the pass rate for just the first attempt at your OSCE is sitting at 35%. So that's 65% of candidates failing the first attempt. That's a huge failure rate. So can you just think of the pressure these nurses and midwives are under, knowing that they're going to go to an exam and there's a very high proportion or chance that they're going to fail it. But the current overall pass rate is sitting at 73% across all of the test centres at the moment. There's some fluctuations between each test centre, which you would expect. But again, the data's out there, so please do have a look at the NMC's website for that. We've included it at the end as well. Next slide, please. So the first element of your OSCE is your API, which is your assessment, planning, implementation and evaluation. So with your, I'll go through the what to sort of visualize first. So all of your stations, they will have an actor at the bed space for your assessment. Typically that's been a mannequin for the implementation station. And you have a mix between hospital or community-based settings. So if you start in the hospital, your scenario will always be within the hospital. You won't bounce to the community or anything. And there's lots of different themes for these. So we've got end-of-life care, we've got homelessness, we've got, oh gosh, my brain's going blank, but there's lots of different surgical scenarios. And again, these scenarios are available online, sort of have an understanding of what scenarios you could face and what you might do to prepare for those. And your trainers will give you the best education and resources to help you prepare for those stations as well. So with our assessment, you get 20 minutes to perform this, and you're going to be presented with that patient in a bedside, so a real actor, and they're very good, these actors. And you'll be in a hospital or a community setting. That'll be clear by the report that you're given, so you'll be able to understand yourself where you are. And this person's going to need a full assessment of their presenting complaint, whatever that might be, and you'll need to take into consideration their past medical history. You need to ensure that you've got the right patient and you're maintaining their privacy, their safety, their dignity throughout, whilst encompassing your 6 Cs. So what you would normally do in a hospital environment, if that's where you're working, you're basically going to do what you would do every single day. You're just being examined for it. You'll then be expected to take a full set of observations and document those findings correctly, and you need to report your findings back to your patient to determine the frequency of the observations that you're then going to do. Throughout this assessment, you need to identify 2 problems that you can then focus care plans on for the next station. So you might identify that your patient is breathless. So you then might think of a few things on how to support that patient through breathlessness. So, you know, what they can do as self-care to support their breathing if they're feeling breathless, what you're going to do as a nurse, how you might escalate this. And this needs to be relevant for the next 24 hours as well. You'll then go onto your planning station where you're going to take those 2 care plan suggestions, so your breathlessness and I don't know, maybe pain, and then you're going to write 2 care plans, one on each of the problems that you've identified with this patient. So you're going to state what the problems are, ensuring that it's all evidence-based, the advice that you've given, highlighting when the patient will be reassessed for this issue and any safe and appropriate treatment options, as well as identifying any self-care activities the patient can engage in. You need to ensure that your documentation is clear and legible and signed. If they can't read it, you won't pass. So if you've got scruffy handwriting, you need to think about how you're going to write under time constraints, maybe block capitals or something, I don't know. But that's something for you to think about. Then we're going to move on to our implementation station, which is your drug administration. So again, this will be in the hospital or community setting, and this will not change. So you're going to be administering your medication. So to do this, you need to ensure your rights of administration, your patient's safety, explaining what the drug is, what it's used for, and any side effects, so the patient can make an informed choice whether or not they want to take the drug or not. You might also need to consider whether or not you need to check any observations, perhaps heart rate needs to be checked because you're going to administer digoxin or something. You'd need to ask your assessor for that information to find out whether or not it's safe to administer that medication. Again, this would need to be fully documented, and any errors or concerns need to be escalated appropriately as well throughout this station. You then have your evaluation, which is the final part of the API, which is essentially, it's your handover of care. So here you're going to be documenting your evaluation or your summary of the care provided by yourself since your assessment. So everything you've done in your assessment, your planning and implementation will be drawn into this evaluation piece, and it will be delivered verbally via an SBAR. So points to remember, you're providing care to the same patient throughout, and you must discuss the relevant nursing needs for the next 24 hours. new addition since October is the Viva. So the NMC had been trialling this in some test centres a couple of months ago, and it's an opportunity that allows the candidates that are typically performing really well throughout the scenario, that might have omitted some information or had said the wrong bit of information, to verbally rectify this at the end of the station. So if they fail to demonstrate some knowledge on an item, they can say, apologies, I just would like to confirm, instead of saying X, I should have said Y on this station, and this is what I would do to correct that situation. It's only applicable though for your first attempt at the exam, not for any future resits though, so that's the point to consider, but that might again change in the future if it's taken quite positively. Next slide, please. So we've got our skills. So we've got 4 skills stations in total for your exam, and they're provided in pairs. So it's between 16 and 21 minutes for each pair of skills in your exam. And unfortunately for adult nurses, we have 21 skills that could be at the moment, and it's significantly less for the other fields of nursing and midwifery. And essentially the reasoning behind this is the adult nursing OSCE is the most regularly taken, therefore it's the most regularly able to reassess, evaluate, adapt, make changes to, compared to the others. So this is why you're seeing a lot more stations, unfortunately, for it. The NMC had indicated that the other fields of practice will get additional stations added through time, as there is the ability where more candidates come through and they're able to assess how the stations are working and what stations might need to be included in the future. So essentially it's a watch this space, you never know what's going to change and when. Most of the time it is with mannequins, but they do state on the test centres that you can have actors in the bed spaces as well for the skills stations. The skills are all on a rotational basis as well. So only the test centre knows the frequency of the rotation and what is included in it. And this means essentially you need to be prepared for all the skills that you could face in your field of practice. Next slide, please. So we've got our adult professional values and behaviours and our evidence-based practice as well. So these are all silent stations and they last 10 minutes each. The candidate's going to receive a scenario which will detail a situation that they face currently, one relating to evidence-based practice and one to professional values and behaviours. So you'll need to write down what you would do to ensure that you're adhering to the NMC code at all times. And for your evidence-based practice, you'll be provided with the relevant research to make an appropriate decision or give advice, and you can use your own knowledge base to supplement that as well. And for your professional values, you're going to be given a scenario where you'll need to uphold the NMC's values. So those scenarios are typically like professional confrontation and what would you do if you saw this? Or so again, these will probably, because this is a relatively new component to the test of competence, it's highly likely that these stations will change and evolve as well over time. Next slide, please. So you've completed the test of competence and you've now either waiting for your NMC pin or you've just got it. So first of all is always congratulations, because it is a really hard examination process to get through. You need to tell your manager and your educator immediately the result of your OSCE exam. Even if you have failed it, please disclose that information because we tend to know anyway. We're able to normally get that information. So if you've passed, make sure you tell everybody about it so that we're aware and we can action the next steps as well for you. So unfortunately, the journey isn't quite over until you've got the PIN. So you've got your NMC online account. Really do check that regularly and make sure you have got full access to that. I've had situations where I've had nurses come back and say, the agency set the account up for me, so I don't know what the password is, and they hadn't even set it up in their actual email address either. The agency had just put an email address in. So make sure you've got full access, because if you don't have the account access, you can't get your results, so you won't ever know that you've passed. So please make sure you've got full access. The NMC will normally email you if there's further documents needed to submit, but sometimes these emails can be missed, they can go in junk, or perhaps they don't actually reach you at all. So please always check the account regularly. It can take up to 35 working days for your PIN to arrive, which is quite a long time, but the NMC typically try to get this process within 5 working days. So it is normally a lot sooner, but sometimes it can be longer. And typically, if you're waiting for a while, it's normally because something needs to be resubmitted. So act quickly when you do have to resubmit documentation, because your 35 days starts all over again from the time you resubmit a document. So bear that in mind. When the PIN arrives, like I said, inform everybody, and you need to give them your statement of entry to the NMC register as evidence. This will have your PIN number on it, it will have your name, and it will tell you the dates in which your registration went live. So your employer will need that in order to process the change form to put you on the correct point of pay that's been agreed. And then just enjoy yourself, settle in, familiarise yourself, don't put too much pressure on yourself. You know, if you've never worked in the NHS before, it's a weird and wonderful place at the best of times, and it does take a lot of getting used to. Next slide, please. So my top tips. So this one's aimed at the employers in the room or your colleagues. If you are an educator dealing with OSCE, I highly recommend joining the OSCE email networks, the future NHS international recruitment platforms, and using the international recruitment toolkits if you haven't already got that. Most people in educator roles of this will be aware of the Pastoral Care Quality Awards and most likely applying for or have already applied for and have been awarded this. But if not, do take a look at it. Check the NHS England and the NMC websites regularly. Quite often updates will go out in regards to webinars, and if you're not subscribed on their newsletters, you can sometimes miss these. So just check the websites regularly, make sure you're signed up to the newsletters. Make relationships with your local community. So within the services, when you have international nurses arrive, they don't have bank accounts, they don't have SIM cards, they don't have GP registrations, they don't have a dentist, they don't know where Tesco is or wherever else they need to look for. Make sure you are aware of this, make the connections in your community so that you can support them on that process. You know, we've built some really lovely relationships with some local banks, with estate agents, and it works really well for everybody involved, essentially. Reminding yourself that pastoral care starts at the very, very beginning before they've even boarded the plane to come to the UK. So please be kind, get to know this person. It's a really challenging time. Just think, if you were in their shoes, how would you feel going halfway across the world for employment when you don't know anybody and you're probably leaving your family behind? So, you know, show some compassion and understanding and really get to know them and make them feel welcome. Learning and understanding your colleagues' culture and what's important to them. Like I said, the NHS, if you've never been part of it before, is a very weird and wonderful place. We've got a lot of systems and processes, and a system for this, a system for that. So making sure that they understand what's going on around them and how this might differ to where they've worked before, and understanding what their role was like before could be really, really helpful, and you understanding how to support them now that they're in your team. Allocating buddies or mentors that have been through an OSCE is a really good idea, because they've experienced it, they've got that lived experience to be able to say, you're going to be okay, you can get through this. I always say avoid nights and weekends while studying for the OSCE. Studying for OSCE is a full-time job, so it really, really needs so much concentration, time and effort involved in it, and you have to live, breathe and sleep OSCE for however long it takes until your exam date comes up. So please be considerate of that, and doing shift work is really hard when you've got to focus so hard on it. Discuss pay based on experience. This is something we've implemented locally in my organisation. You know, and there's no reason to employ international nurses just into band 5 roles. I've employed directly into band 7 roles successfully. There's no reason nobody else can do that. And allocate more time to support this person in the UK compared to your UK trained nurses. Again, it's going to be very different to what they used to. Next slide, please. So this is more for the international nurses in the room. So when you're preparing for your exams, please take a look at the university resources that are available to you. They're really good. You have an ADLs form as part of your API. It's essentially a scrap piece of paper that you can jot down anything you want in it. It can be in any language you want. It can be just scribbles. It can be drawings. It can mean absolutely nothing to me, to your assessor, as long as it means something to you. And you'll always get that back on a resit as well. So bear that in mind. It's a really good scrap of paper to have. If you feel nervous, stop what you're doing, take a nice deep breath in, pause and just exhale. You'll find that it will really help you to refocus what you're doing and prepare you to do whatever it is you need to do next. And you take less time than being anxious and nervous trying to get your words out. Ensure you got your full access to the NMC online portal. Believe in yourself. The amount of people that tell me they can't do this, it's too hard. Yes, it's hard, but you can do it. You've got this far, you can go further. Be open and honest with yourself and your trainer. We're here to support you, help you through this process. If you're not open and honest with us, I can't help you. Check the portal twice a week just in case you've missed any updates. And don't trust your friends in the nicest possible way. Just because your friend sat an OSCE, perhaps they sat an older version of the OSCE, and things change. Like I said, it's always changing the OSCE. Quite often there's updates every couple of months and slight amendments to the marking criterias. Your assessors, your educators are the best people in the room to support you in your OSCE. So please take what they say as the best advice available to you. Check out the online resources available. We've got some great stuff on the RCM website as well. So live your life like an OSCE. So if you're going to do some cooking at home, do it OSCE style. You might look a bit crazy, but it's okay. Your colleagues will be doing it too. Don't overcomplicate things. Keep it simple and keep practicing, and do it as a mock exam as well, because that'll really get you in the mindset of how it might look on the day. The RCN's recently released a really good guide to common English expressions, such as I'm just going to go spend a penny, which isn't going to the shops. So please do take a look at that. It's really helpful. And please, just because Sally started working in your ward 6 months before you doesn't mean Sally has to get a promotion before you. So bear that in mind. You can apply for a promotion as soon as you feel ready. Next slide, please. So subsequent registration, this is new from 2021, and basically this is for your international candidates that have got the ability to be joined on any part of the NMC register. So perhaps they, in their country of origin, they're able to be a paediatric nurse, midwife, adult nurse, whatever. They've come to you as an adult nurse. They've completed their adult test of competence and they want to do a paediatric test of competence. That will enable them to be dual qualified and dual registered with the NMC. So this has a real good potential as an employer's perspective to support areas such as paediatrics and maternity, which are harder to recruit into because it's such a specialist skill set needed. And that's it from me.
Thank you, Charlotte. I think we've got one more slide to share. Please have the next slide, please. So, Charlotte, I think you've got some useful links and resources that you're sharing with colleagues on the call today. Could we have the next slide, please? Thank you. So, why should you join the Royal College of Nursing? We'd love you, if you're not a member, to join our community of over 500,000 nursing members, and that's nurses, midwives, nursing support workers, our student nurses, as well as assistant practitioners and nursing associates and HCAs. Our services support you both professionally and personally, and I'm hoping if you are a member, this is a really good reminder of the services that are available to you. If you are not a member, please obviously have a look at this slide in terms of what it could offer you, and if you've got colleagues around you that aren't members, please promote where you can all of the services that we offer. We are the world's largest trade union and professional body for nurses. So within that offer, within your membership from us, there is personal development. So we have lots of resources online, and in our physical library in London, in Cavendish Square, which you are, as an RCM member, able to go and visit. We have professional forums and networks to give you the latest updates on your professional areas of interest, as well as lifelong development to be able to access through the RCN Learn, through the Nursing Library, and for social care learning resources as well. So a huge amount as you grow and develop within your role, or as you start, but as you grow and develop professionally to support you. We offer workplace support. We have regional teams across our English regions, and we have teams within our RCN countries to support you with any specific trade union support that you might need, and that might be specialist workplace support and guidance. We also have local networks across the NHS and independent sector of representatives that also can provide you with good guidance, advice and support. We have legal advice. You'll receive comprehensive support from our RCN legal team. We have a employment relations legal team, we have an NMC legal team, and we have an immigration advice service for our internationally educated nurses. And you'll see that under our next point of member support. That immigration advice is absolutely second to none, and should help and again advise and guide on all immigration matters. We have welfare guidance to support you from your peers around if people have disabilities. There's peer support, there's coaching, as well as financial wellbeing right through our welfare guidance and our welfare team. There's telephone counselling as part of your membership, so should you find that you need some support outside of your employer, our counselling service is bespoke for our members. And again, the handy guide there you'll see in the list that Charlotte just mentioned around English expressions, which we hope that you'll find helpful and interesting. Our careers advice is an amazing service. It's really extensive and provides nursing careers resources. So if you have come into the UK to work, but you're thinking about how do you grow and develop beyond your NMC Test of Competence and achieving your PIN, all of that information is available online via our RCM website. So really would welcome you to share this information with colleagues, but also think about it if you're not an RCM member, why you should think about joining us. So thank you. Charlotte, I think we're going to move to some questions. So if you bear with me, I can see we've got some questions here. So let's go through them. Bear with me. I think I've not got the most recent ones in front of me. Okay, so what pastoral care did you recommend for educators?
So if this is for recommending educators do, it's reminding yourselves that the journey this person has come on just to get to you in the UK potentially, and factoring in that you should really make contact prior to them even stepping foot on the plane and making them feel warm and welcome and secure before they arrive. Reassure them what you're able to do, reassure them of your training programs, the support that they're going to get when they're here. Because a lot of the time I hear that people have poor experiences, and it comes down to that communication element and just feeling safe, secure, welcomed, the basic stuff. We just need to work a bit harder on the basics typically.
Thank you, Charlotte. I can see that colleagues have shared some information online about next sessions that are available, so please have a look at those. Somebody's asked, could you please tell us about the combined test results for the IELTS?
The combined test results, irrespective of IELTS or OET, it's the same. So if you have failed an English language test the first time, but it meets the NMC's criteria to resit and combine both tests to create a pass, you're able to do that. So you can take a secondary exam. So if you've done IELTS to begin with, it has to remain as IELTS. You can't combine an IELTS with an OET. You can resit that exam within a 1-year period of the initial exam and combine those test results together to get your overall pass. So you might have failed reading slightly on that first exam, but you've passed everything else. And so you'll then have to resit that next exam and meet the required grades for reading only, but getting the baseline for the other components of the exam. It is complicated, but it is clear on the NMC's website. You can put in the grades on the test calculator there, and it will tell you if it meets a pass, if it meets the ability to resit and combine tests, or if it's too bad a failure to then need a complete resit entirely and it needs to be disregarded. So the NMC website does have a really good calculator on there that you can use. I hope that's clear.
Thanks, Charlotte. I think this next question might sit in line with what you've just said in terms of credibility and where you go for credible information. So there are practice tests online and free sample questions. Are these credible?
It depends what you're looking at. So for your OSCE, there's some really good training resources which have been provided to the universities who are your providers of that exam. So you can get the training resources required via your university. Once you're enrolled at the specific university to sit your OSCE, you have access to their online training platform and all of the resources there to practice. Your educators in wherever you work, they will also have their own in-house resources which are tried and tested and very good. Sometimes there's some YouTube videos, there's some random links on Google. I don't recommend any of them unless they're from Health Education England, Royal College of Nursing, your employer, the universities or the NMC, because like you said, you can't be sure on the credibility of them. You just you have to use the official resources available to you.
Thank you, Charlotte. The next question is, how many APIs do they need to complete?
So that's just one. So there's multiple different scenarios you could face. And again, that's on a rotational basis. So it might be that you attend the exam today and you have the surgical API. So you'll be doing one API on this surgical scenario and you'll be following this one patient through. And if you was to fail that API and need to come back, it'll be the exact same scenario and you'll only have to resit the components of the API that you failed. So if you passed everything except for evaluation, you would go back and repeat that surgical evaluation that you failed. You wouldn't need to repeat the whole API and E. Hopefully that makes sense.
Thank you. The next question is, can I do this? And I think you might have answered this earlier. Can I do this before I come to the UK? And if so, how long can I do it before I come to the UK?
So it is impossible to do an OSCE outside of the UK. It has to be done in the UK, the OSCE. All other components that can be commenced prior to arrival in the UK. So you can complete your English language, and I always recommend not even to consider applying for jobs until you've got your English proficiency sorted, because if you go down the testing route, some people, it can take up to 2 years to prepare and sit for that exam. It's hard work, and so don't underestimate it. And with your CBT, that's typically quite a quick thing to book, and test centres are readily available internationally. There's not normally a long waiting time to get that arranged, and typically, like I said, 80 to 90% of all candidates pass that on the first attempt. So get those two under your belt before coming to the UK. Most employers would not interview you or offer you a position until those two things are done anyway, and with just the OSCE outstanding.
Thank you. The next question is, where can I find information about the OSCE approved test centres, and can I apply to more than one?
Sorry, it broke up a bit, but I think I got the question. If not, just correct me. So you want to find out information about the universities, and can you apply to multiple universities test centres?
Yes.
The answer is, if you just search up on the NMC website, NMC OSCEs, the test centres will come up. They were listed in my slides above. I've put links in the resources which will also list the test centres. All of the test centres website, it has the readily available information on there, so you can get your marking criteria, you can get the top tips, supporting information, guides, all on every single university webpage that conducts the OSCEs. However, you cannot apply to multiple test centres, and typically your employer will book an OSCE. There's such a long waiting list for the OSCE test dates. Your employers typically book batches months and months in advance before we even have nurses arriving to sit those exams, because there's such a long wait list for them. So typically you don't need to book any of this. This is your employer's responsibility unless they state to you otherwise. But yeah, we typically will know any nurse that arrives in our organisation in October, we know that they will 100% sit their exam at the end of November, for example. We'd have a date and we'd know which university that is, because we directly apply to the individual universities.
Great, Charlotte, thank you. We've got one last question, and colleagues, please, if you've got any other questions, please pop them into the Q&A tab at the top. What support can I expect from my employer during my test of competence?
So you won't reach your employer if you're coming internationally until you're at the point of the OSCE. So if you're looking at support via the OSCE only, it varies. There's no gold standard or set process on how we offer that support for an OSCE. Each employer and organisation does it differently, and there's no right or wrong way in doing that. But as a minimum, I would expect you to have a go-to educator. I would expect you to have a dedicated time for training, and I would expect you to have the resources available to you to support that learning environment, with a clear and structured plan on how this will be done, and the ability to sort of discuss any concerns with that educator if there is any concerns. And I'd always expect there to be a minimum of one mock exam made available to you. Like I said, this will vary different employers, and they might have different approaches, and it works well for them, and there's no national expectation on this. Equally, if you are already in the UK and you're perhaps working as a healthcare support worker and you're looking at doing your English and you're looking at doing your CBT, it's at the discretion of your employer and your manager, essentially. So if that is you, speak to your manager, explain to them that you would like to join the NMC register and it would involve you doing this process. What can they do? It might have to be more of a bespoke program for you. They might allow you study days, they might not. I don't know, because typically this is done outside of employment for people coming internationally. So it would be the discretion of your employer as to what support they would offer you.
Thank you, Charlotte. That concludes the questions that we have this evening. Can I say a really big thank you for presenting this to us? Colleagues on the call, there is an evaluation sheet within the Q&A, a link. Please go into that link. If you're able to provide us with some thoughts on how you feel this evening has been helpful to you, that would be really great. And it will also generate a certificate for your portfolio if you're able to send us some feedback. So thank you very much for joining us this evening, and that concludes our event.